are busy treating patients. So please ask important questions, what you have or what people have asked you about COVID-19, so that we can try answering this. So with this background, I have divided today's topic under the following headings. Okay, sorry for the technical glitch. So the contents what I'll be talking about is what is COVID-19 disease and why are we worried about this as a pandemic. Secondly, I'll be talking about how COVID can present and when to suspect, because suspicion is important, not because we are investigators here, so that the individual and as well as the community can be protected by early diagnosing the disease. What are the detecting measures, the diagnosis measures available for COVID-19? Because people have a lot of queries on this. We'll discuss all the diagnostic measures what are currently available in Mangalore. Then we'll talk about what challenges we are facing as a community, as health system, as doctors, and also as general public, what problems we are having with this second wave. Then we'll talk about prevention measures. So I think here we need to discuss a bit more. That is about the currently available vaccines, what vaccines are likely to come in the near future, and also COVID appropriate behavior, and the issues with vaccine eagerness and vaccine hesitancy. Both we are seeing now. Initial part, there was vaccine eagerness last year, this time. We wanted vaccine desperately. Then when the vaccine was out, the safety data was not out, so there was vaccine hesitancy. And now with the second wave, most of the people want to come and take the vaccine, but unfortunately there is shortage of vaccines. So all these are part of a pandemic. That's why we call it as a pandemic, when the resources are falling short and the healthcare system is pushed to extreme. And lastly, we'll talk about important take-home messages. As students, as youth, as the building block of the nation, what important things you need to know so that you can create awareness using these messages. Can I have the next slide, please? Yeah. So about COVID-19, I think everyone knows about this. It started in Wuhan, and there were a lot of questions on this about the origin of the virus. So this is basically a virus. I think everyone knows it's an organism which causes respiratory illness. So coronavirus is the family to which COVID-19 belongs. So it's not a new virus. It's not a totally new virus. So coronavirus are known to cause disease in humans, and it has been present from a long time. But what was a concern with this particular virus was the ease at which it was spreading, and also the fatalities which it was causing. Although fatalities with the pandemic were exaggerated much in proportion to what it is causing. If you see even now, the global number as well as the Indian number and even Mangalore for that example, it's somewhere hovering around 0.9 to 2%. That is, out of 100 people who get COVID, okay, 2 people die. And that too, if the care is not received appropriately, that is at time and correctly, if it is not diagnosed and the patient doesn't get care, that's the time when the virus can be dangerous. Okay, otherwise it's like a simple common cold itself. Okay, but apart from the common cold, what it does is the virus enters inside the lungs, okay, and thereby it starts compromising our respiratory functions. Imagine if we are not able to breathe, okay, if we have difficulty in breathing, oxygen doesn't reach our vital organs, and that's the time when this virus causes most of the complications. So India also had the problem after China. Almost every country, there are hardly any country which said, except for 2 or 3 countries like North Korea and a few other countries in Africa, who are not notifying there are problems with other issues there. I'm sure these countries also have COVID, but it is not being detected. Most of the countries have succumbed to this or had issues with this COVID-19 pandemic. And in March 2020, WHO had to declare it as a public health emergency of international concern, because it was not restricted to one country, although it started or was detected in one country. It was causing havoc in almost all the countries by its rapid transmission and major burden on healthcare system. Next. So what is a pandemic? If you see, pandemics have been happening from a long period of time, okay? And if you say, if we are not prepared for a pandemic, we did have pandemics. Even in 2009, we had the swine flu pandemic. But the concern with this, the current pandemic of COVID-19 was, can be equated to the 100 years back, almost 1918, when we had the H1N1 outbreak, or also called the Spanish flu, okay, where strict lockdown measures, containment, quarantine, all measures were followed then. Okay, but the pandemics which happened later on, there was not much of an incidence. So what is a pandemic? Pandemic is something which, as I told you earlier, affects a lot of countries. Okay, so if you go by the WHO definition, if it happens in 2 or more WHO regions, okay, so it is not restricted by any boundaries, and it's happening at the same time in multiple regions, creating havoc and causing resource constraint, that time we call it as a pandemic. And how does a pandemic evolve? Once it starts in a country, like we had the first case in Kerala, then we had almost a gap, long period, 1 or 2 months gap was there. And then again it started. So initially, if you see, there were what is called as the stage 1 of the outbreak. We also saw the same. It was mainly through international travelers, because India, or in our country, we didn't have any local cases. So people were getting these cases mainly from other countries when they were traveling. So mainly travelers from China, Italy, France, Spain. So these were the countries which are badly hit at that time. So this was the time at the initial part of the pandemic, that is January, February till March, when we had only direct cases where international travelers were the people who were affected by COVID-19 and they were getting the case. The second stage is what is called the cluster transmission. The cluster transmission is said to happen when an international traveler is coming to a community and thereby he's spreading it to local people, and now the transmission is happening in a community but in a controlled setting, that it is not causing widespread outbreak, but you can identify who was the person who initially started the disease, and all these people will have a common household setting or a workplace setting. So we can trace easily, and if containment measures are good, if prevention and control measures are good, we'll be able to control the settings or control the outbreak. So unfortunately, it didn't get restricted. We couldn't do a cluster restriction, and we have reached the community transmission. So community transmission is the stage where we will not be able to know who's causing the disease. Okay, so imagine if I'm tested positive and I'm telling, actually I got a case, I got this disease from someone who's there in my workplace or my patient, but I don't know. Probably I was having the symptom first and I might have given it to the patient. Okay, or I might have got from someone else itself. Okay, so this is the problem. We have entered community transmission, and although a lot of people deny it, but still definitely we have reached community transmission. That's why we are engripped and we are evolving with the second wave also. There is widespread community transmission, and also with the mutant strains, the mutant virus strains, which are creating havoc now. And the last stage 4 is the epidemic. Okay, so epidemic is when it involves massive geographical areas. Like for example, if a scenario like Maharashtra is seen in the entire country, okay, that will be the stage 4 and epidemic, and that will be really, really bad. And we should be ensuring as a community, as good Samaritans, that this situation doesn't reach, because if this reaches, God has to save us. We don't have a healthcare system, we don't have hospitals to take care. Although the mortality is less, but imagine there is a difference. Okay, 2% of 2 lakh and 2% of 2 crore. That will be a huge difference. Okay, so ours is the second largest population, so we'll have very, very bad problems when it comes to the healthcare system. Next. Yes, so this is the WHO figure yesterday. So if you see the number, it looks like a magical number. It's somewhere around 146 million cases. Okay, and that's a huge number. And if you see fresh cases, almost 794,000, of which 50%, that is 352,000 cases, are contributed by India. And of yesterday's 12,470 deaths, almost 20%, that is 2,812 cases, are from India. Okay, so we are topping now in terms of both the daily contribution of cases and also the number of deaths also. So nothing to be proud of. It's actually a great concern, and India is being stretched to its extreme now. The healthcare system is being stretched to the extreme. The main reason, what we can say, is because of lack of preventive measures, lack of awareness in the community, as well as good policy and as well as actions which could have led to prevention of this particular epidemic. And obviously preparedness and response issues, it might be health system, the policy makers, bureaucrats, politicians. There is no point in blaming each other or anything like that. That's how pandemics are. Okay, we can't say this fellow didn't manage, that fellow could have done it better. Pandemics won't spare anyone. So this is what we are actually being put in. Okay, so it's really sad we are in this particular situation. But again, coming back to the same point, we can still prevent. Otherwise, imagine we can still reach a worse situation with time coming in the next 4 or 6 weeks. Next. This is the Indian figure, the Ministry of Health and Family Welfare. So almost 16% of the cases are active cases as of now. So 68,000 added on. So yesterday's number is 2 lakh fresh cases, 2,51,000. So fresh 2,771 deaths which have happened, and Karnataka is having also having a lot of cases. Now it is in terms of active cases, it is surpassed Maharashtra. Although the number of new infections and deaths are less, but active cases in Karnataka is very high, and that's the concern why we need to act early and fast. Now, knowing all these concerns, so when to suspect a person is likely to have COVID? So we'll just see the suspect, probable and confirmed criteria for COVID. And this is very, very important, because unless you suspect who's likely to be a case of COVID, we will not be asking these person to get tested. And again, as we have already seen, and we must have already read, a vast majority of our patients are asymptomatic. Almost 75 to 80% of these patients are asymptomatic. That's mainly because COVID manifests in mild forms. And once people get to know that it is in mild form, even a minor illness, like for example, a small body ache, sore throat, fever which is there for 4 to 5 hours, people generally tend to ignore and they say it is asymptomatic. Okay, but you need to be concerned. There needs to be awareness. You need to go and seek care. Okay, so you don't want to give this infection to your loved one who may not have that good immunity to fight against this particular disease. You may be young, you may be strong enough, your immunity may be good, and you might be recovering from it. You might be in that 98%. But imagine if it is one of your loved one or a totally unknown fellow to whom you are giving this particular disease, or a pregnant lady, okay, or a lactating mother. Like one of my students today morning, she called. She had flown all the way from Italy, and she has a kid 3 weeks old, and she's taking all the possible precautions, and unfortunately she's not able to take the vaccine, a doctor herself. But one of the family member has acquired COVID now. You can imagine the stress what the mother will have about the baby, about her health. So we don't want this kind of a situation to happen. So what are the symptoms possible of COVID? So suspect, we have both clinical as well as epidemiological criteria. Okay, so clinical criteria, so any acute onset that is recent onset of fever and cough, or any three of the following acute onset symptoms like fever, cough, fatigue is tiredness, headache, myalgia, sore throat, coryza is nasal discharge, breathing difficulty, which is dyspnea, vomiting, diarrhea. We are seeing very commonly now in our primary health centers, also in the hospitals, also a lot of cases coming with diarrhea and fever, and altered mental status. Okay, so if any three of them are there, he will be a suspect case. Plus, epidemiological criteria also is very important. That is, in the last 14 days, if he has been working or staying in an area with a high risk of transmission. That is, there are a lot of cases of COVID, and it has been declared as a containment zone. So, definition of containment zone have already have kept changing, like the treatment and testing criteria. So, as of now, any area with more than 5 cases, any building with more than 5 cases, it may be a hostel, it may be a flat, okay, or traveling to an area with confirmed community transmission, that is stage 3 of an outbreak, and people working in healthcare settings in the last 14 days, or you have come in contact with the healthcare setting and coming with these particular symptoms, will be taken as a suspect case. So if you come across a suspect case, or if you are one of the suspect cases, you have to get tested for COVID. Next. So if this is a suspect case, what is a probable case? So likelihood of COVID increases from suspect to probable. Okay, so a person who is a contact of a confirmed case, okay, a diagnosed case who has come in close contact, like it may be his workplace colleague, or who's staying along with him in the same dorm or room, spouse, children, or parents of a confirmed COVID case, because invariably we don't tend to wear mask indoors. And what we are seeing with the second wave now, unlike the first wave, it is causing high infectivity. The transmissibility is linked with one mutant strain, the UK strain. So, India has, Dakshina Kannada has both the UK strain, which is highly infectious. So, we are seeing everyone in the family is turning COVID positive now. Similarly, the fatal strain, the South African strain, also we are seeing there are more mortality. People are diagnosed, they are delaying seeking the test, and COVID is worsening, and suddenly there is a need for ventilator, and most of the time we are not able to bring them back the moment they are going into the ventilator. So that is the thing which we need to prevent. Okay, so that they seek care early, and if the conditions are deteriorating, they get admission on time. Okay, so this should be the emphasis. And at the same time, we have to ensure not everyone who is COVID confirmed seeks for a hospital bed, because we have reached the stage where we are seeing almost like 600, 800 cases every day. So we don't have, although we have 6 medical colleges, still we don't have that facility so that we can take care of everyone in the hospital. Okay, so we need to ensure, and it's our responsibility collectively, not just on the hospital or blame the politicians or blame doctors. So we also need to understand, we have to prioritize. People who need care are these people who are moderately or severely ill, and they need oxygen, they need ventilator. And people who are having mild symptoms like simple cough and cold, just be at home, keep monitoring, keep following advices, keep in touch with your doctor, and also follow appropriate precautions at home so that you are not spreading it to others. Then other people are suspect cases with chest imaging, that is HRCT or X-ray suggestive of COVID-19, while RT-PCR results are awaited or not yet done. Very important, any recent onset of anosmia, that is loss of smell, or ageusia, which is loss of taste, and there are no other causes for this. Okay, so very likely that the patient is having COVID-19. And lastly, we call any death following respiratory distress, which is not confirmed. Okay, a lot of cases come directly to morgue like this. So again, this needs to be evaluated during the pandemic time that it can be COVID-19. So the third, I told you suspect case first. The second one is the probable case. And the third one, which we'll be discussing, is the confirmed case. Next slide. So who's a confirmed case? So confirmed case is for short COVID. Okay. So in the first 2 criteria, we are thinking he may be having COVID. But because there are so many conditions which can present or mimic symptoms like COVID, we need to have a confirmed diagnosis for COVID. That's why we keep asking for a microbiological confirmation. Okay, so we'll talk specifically on diagnosis later. So what is a confirmed case? A person who is positive for a nucleic acid amplification test. That is, we collect a body fluid or a sample from the patient. Most common now is oropharyngeal and nasopharyngeal. You might have seen a swab which is put in the throat and also in the nose. And from there, we are trying to amplify the viral RNA, which will be there, because these are the two parts where the virus is most likely to colonize. Okay. So when we are normally talking, when we are coughing, when we are sneezing, actually sneezing generates the highest amount of aerosols, which will have the highest number of viruses. So that's the part which will be easily colonized by these viruses. So we'll be trying to amplify this viral RNA through these samples what we have collected. Similarly, the only issue with these tests is it takes sorry, can you just go back? Only issue with these nucleic acid amplification tests like RT-PCR is it takes a slightly long turnaround time. That is, from the time of taking the sample for the report to come positive, it takes around 24 to 48 hours. And when the sample load is high, like in the current setting, when there is a pandemic, okay, and there are a lot of samples, a lot of people having symptoms of the disease, and everyone has to be tested, okay, it takes a pretty long time. I just got a call like almost 10 minutes before starting this talk. I got a call from one of my friends in Delhi. Their samples have been taken 10 days back and still the results have not yet come. Okay, that's the problem or the issue which is happening in Delhi. And in Mangaluru also, a lot of people also have the issues. Like for example, yesterday in my clinic, there was a patient almost from 5 days he had given the sample, still reports are awaited. So this keeps happening with samples which require thorough processing. It needs a laboratory. It can't be done anywhere and everywhere. So for that, government had also procured something called a rapid test. So rapid test, again, it's not as sensitive as the previous test, that it may not be detecting all cases. It may have a lot of false negatives. But when we do rapid test in a symptomatic, and if it comes positive, okay, it's more likely to be COVID than anything else. Next slide. So coming to the diagnosis of COVID, I have already told you the two important things, that is suspect, probable, confirmed. Now adding on to other tests, which I'm sure most of you might have kept hearing about or reading it in textbooks or heard from other person. So other tests are antibody tests. These antibody tests are mainly done for trying to find out if the person has, in the NAT and RDT, we are taking samples from the nose and throat. In antibody test, we take samples from the blood. So, someone has raised hand. Okay. So, we take samples from the blood of the patient and to see whether the person is having specific antibodies. So, antibodies is mainly the immunity or the strong immune response what the person generates to this particular virus, so that even if the virus is trying to enter the system, the person will not develop the disease. So this might be seen in people who have already had infection in the past or people who have taken vaccine. So as vaccination is going in a good pace, and we have covered a small chunk of the population, that is more than 45 years, healthcare workers, frontline workers. So a lot of people want to know, especially healthcare workers, doctors want to know whether their antibody titers are safe. Again, this can create a false sense of security. That is, they can let off their guard. If they see their protective antibody titer, they may not use COVID appropriate behavior and they may be at risk. So that is one risk with these antibody tests. The next one is the genomic sequencing. So what is this genomic sequencing? I was telling you earlier, as compared to the first wave, now we are seeing a lot of mutant strains. The virus has mutated. So that is what happens with RNA viruses. When they are there in the environment for a long time, because they have to survive, otherwise they will be dying their natural course, they keep mutating. So mutating can happen, when mutation is happening, they may become less virulent. That is, the likelihood of spreading the infection from one person to another person may become less. The infectivity becomes less, or it may become more. Okay, so both can happen, and we have few mutant strains which are of slightly bigger concern than the mutants which are being less infectious. So to detect these mutant strains, we need to do their genomic sequencing. Now this again, imagine NAT or RT-PCR itself takes a long time. genomic sequencing cannot be done in every individual. Okay, a small percentage, although we have 1,000 laboratories right now through the India Genomic Sequencing COVID Consortium, but still it's a very small percentage. It's very, very small percentage. We just know what are the strains right now, and that's how we get to know that we have a UK strain, we have a South African strain, we have a Brazilian strain, and we have our own Indian strain now, which is a triple mutant, okay, which has mutated twice. So that is what we get to know with this genomic sequencing. Okay, so again, remember, we can't do this everywhere, and in Mangalore, we don't have the facility to do genomic sequencing. Now, coming to the radiological investigations, people must have heard a lot about CT scan. So, or high resolution CT, what we keep saying. So this is another important supportive evidence or a radiological evidence which people keep doing for COVID. But you need to remember, a radiological test for COVID doesn't say whether it is actually a COVID infection or not. So radiologically, a person whose lungs is infected with COVID or any virus for that matter, okay, or any other infection, okay, will be having signs of pneumonia or ARDS, which are all lung pathologies. So if your lung is infected with this virus, again, which doesn't happen in every case. So if you are relying only on CT scan to see whether it's COVID or not, you may be missing a majority of the people who may not have COVID, which has reached their lungs yet. Okay, it may still be there in their nose, in their mouth, in their upper airway tract, and they may be giving happily to people around. Okay, so HRCT cannot be used as a diagnostic thing. So this is very, very important. So it is used mainly as a prognostic evaluator for people with moderate or severe COVID to see how they are progressing. So if they have a lung ailment, if they have breathing difficulty, so what is the degree to which this COVID has damaged their lungs, that can be told by CT scan. Other radiological are not there. The last supportive one is the inflammatory markers. Okay, so these are also not specific. People keep asking for this. Moment they are COVID positive, we need to get these blood tests done. Okay, so what do these markers suggest? So each marker has its own significance. Say for example, CRP is increased in any infection. Okay, it need not be COVID, so definitely it will be high. D-dimer, it says a patient is having a clotting problem because of COVID or any other disease also. Okay, similarly, interleukin-6 will suggest there is a cytokine storm. There is a lot of infection, and that's why these antibodies, these interleukins are raised. So everything again is supportive. It is not needed in a patient who is healthy, who is not having any symptoms. So please don't run after labs or crowd labs, because unnecessarily the patient turnover or the turnaround time needed for these investigations, which need to reach a severe COVID patient, may be delayed. And these supportive inflammatory markers decide what treatment, what specific drugs the patient needs to get. So not every patient needs it. And similarly, it may have to be repeated every 72 hours or before, depending on the patient's clinical condition, if it's deteriorating. Okay, so it's not needed. It is just supportive. It doesn't say you are having COVID. So these are the queries. I think if I take my phone now, there are more than 1,000, 2,000 CRP D-dimer values. There are about 800 or 900 CT images. But what is important still, and the most important, is RT-PCR or the NAT, which will tell whether the patient is having COVID or not. Next slide. Yeah, so how the diagnosis is done. So I told you, if you are a probable case or a suspect case, your doctor will ask you to get your COVID test done. Now, it's left to you also, and you people as volunteers need to create this awareness. You have now understood what are the symptoms likely to be of COVID. So ask these patients, motivate them. Even I have a problem convincing patients, okay, because people have that fear even now. If I, with the first wave, what was happening when they were having the symptoms, people used to come, there would be a police escort, and there will be containment. The neighbors will start seeing them with stigma. Okay, they'll be taken in an ambulance, okay, as if we have committed some crime, okay, put in strict isolation. So all these things are still there in people's minds. So they don't want to come forward and get the testing done. Okay, so you have to tell or motivate the people. If there is symptoms which are likely to be COVID, please get yourself tested. Okay, please get yourself tested, because you may be thinking it's a minor cough and cold. You might have gone in the rain, or you had a cold because it's warm and humid. These are the reasons. Actually, people keep telling to avoid getting tested. But what's the harm in getting a test done? Okay, at least get the test done. So if you can see in the left-hand corner, this will be the small container and 2 swabs which will be given to you if you go to any PHCs. Okay, so first, initially, swab will be taken from the mouth, and second, it will be taken from the nose. And moment this thing is done, you will be getting a unique SRF ID, a 13-digit ID on your mobile phone. So you have to be very careful whose mobile number you are giving. If it's your number, your name will be coming against the result, what is being done. So the problem is, if you keep giving the same mobile number, okay, it may be coming as a duplicate entry. Okay, so and if you are other thing which we are seeing in the first wave, which is not seen in the second wave at least, is moment your report comes positive. A lot of people used to do lab shopping. Okay, if your report has come positive in Father Muller's, let's go to AJ. If it comes in AJ also, let's go to KMC. Okay, at least hoping for one negative. So finally, you can blame the lab. But imagine RT-PCR, if it's positive, it's most likely, and 80% with 80% sensitivity, it's most likely to be COVID, because the nucleic acid of the RNA is being amplified n number of times. Okay, so the testing which is done with the SRF ID is directly linked to the ICMR, because only ICMR accredited labs. Okay, currently we have 6 in Mangaluru. Okay, including Benlock and the other medical colleges, private medical colleges. So only ICMR accredited labs are allowed to do a COVID-19 testing. So there is no need of any suspicion. You need not doubt whether they are actually of good quality, whether reports can be wrong or anything. Yes, I do agree with the current pandemic because of the mutated strains, again, which is not confirmed, but few people have raised concerns that RT-PCR has come negative and CT was suggestive of COVID. So that also may happen. But please keep the trust on the system. RT-PCR has to be the standard test all the time when the patient is suspected to have COVID-19 symptoms. Next slide, please. So this is a good system. If at all you don't get a call or you don't know when your test is done, the 13-digit SRF ID which has come to your mobile phone, you can type, okay, and with the captcha which is there down, okay, you will get to know on this website what is being given down. The test status, the test result status, whether you are positive, whether you are reactive, non-reactive, negative for COVID. So everything will be known through this app. So you need not keep worrying, keep seeing this every 24 to 48 hours to know your COVID status once you have done the test. Now, why there is a need for diagnosis? Now, diagnosis is needed both for community health as well as the individual. So for community health, it's needed for early detection so that we can catch the patient. I'm saying catch because we don't want him to spread it to n number of people, because it's a virus which is transmitted airborne. Okay, if it was through food or water, we could have thought about other measures like boiling or heating it, some other measure. But it's very difficult to restrict something which is in the air. And in a country so vast like ours, and with living conditions, ventilation, everything being not adequate, so likelihood of transmission is higher. So we want to detect at the earliest. The second one is to contain the spread. We don't want people to spread the disease to n number of contacts. So what do we do for containment? We do something called a contact tracing. And a lot of people are irritated by this also. But it's an important thing which is needed in public health. That is, what is this contact tracing? So for example, let's say I'm positive for COVID. Today my results have come positive. Okay, so all my family members, all my workplace employees who have come in contact with me, okay, who are within 1 meter distance, who are in contact without mask for more than 15 minutes. And it is not just from the time of testing. Okay, it has to be 48 hours before the onset of symptoms also. Okay, so 48 hours, that is 2 days before also, all those who have come in contact with me will be calling as a contacts. So all these people will have to be traced, and this is being done 3 or 4 times. That's why people get irritated. You'll get a call from the COVID war room, which is there in Mangaluru City Corporation, which is doing a wonderful job. You'll get call from the DC office. You get call from the revenue department because they want to know the numbers, because they want to seal down the area as a micro containment zone or not. And obviously the PHC, they also want to know, because finally it's the PHC medical officer and his employees who will come and do the testing for all these contacts. So testing is done now on day 0 and day 7. Okay, in the Karnataka states, it's differing from multiple states, but day 0 is the time when you have come in last contact with that particular patient, or the moment the result has come positive. Okay, and he is being you have known as this patient as a close contact of you. And day 7, okay, is 7 days from then. So twice we are testing, and all the high risk contacts, that is people who are without mask, obviously indoor people. Most of the time when we go inside our house, we trust our family members, and that's what is happening unfortunately with the second wave. Everyone, as I told you, everyone in the household is coming positive because we are letting off our guard down. We don't wear masks, we don't follow social distancing, and it's very difficult also. I totally agree, but if we have to restrict, we have to follow this. Okay, so day 0 and day 7, every primary contact will be tested in the will be identified and tested. That's what is the guideline now. So you should be remembering this. So if at all, if he's negative on day 0 as well as day 7, still he needs to be in quarantine. So there are two terms which people often confuse: quarantine and isolation. So quarantine is needed for those contacts who have come in contact with a positive COVID case, okay, but they are asymptomatic. They are likely to be infectious because already there is a spread. Okay, so we say quarantine for them for 14 days because 14 days is the maximum incubation period of the disease. So what is incubation period? Incubation period is from the time of getting the infection till the symptom starts. So for COVID-19, it's somewhere around 2 to 14 days. Okay, say for example, as I told you, now if I'm having the symptom and today I have come in contact with anyone, okay, so it might start 48 hours back to the next 14 days. Okay, so the person will have to stay in contact or will have to stay in quarantine for another 7 days. That is, after day 0 and day 7 is negative, another 7 days, which makes a total of 14 days. He'll be in quarantine. And in between this 7 days, that is, let's say on day 9 or day 10, he develops symptoms, he has to go for testing again. Okay, but people say, I was negative, two reports are negative. So should I test again? Yes. So this is very important. They have to test. Okay. So a person who is tested positive, when he's asked to be away from others, okay, maybe at home or at hospital so that he's not spreading the disease, that time we say isolation. So containment is for non-positive cases who are likely to have the disease, and isolation is for those people who are already diagnosed COVID-19. Then in the community level, what else we need for? We need to see what is the geographical spread of the disease. Okay, so where all it has reached, whether it's restricted to urban, it has gone to rural areas also. Okay, it has reached all corners, and also whether these mutants are variants of concern. Variants of concern are those mutants which are causing high death or high transmissibility. So it needs a lot of epidemiological as well as laboratory things to say it's a variant of concern. So as of now, India, we say there are no variants of concern. So luckily, we are not having those many mutants. Next, surveillance measure to see again detect at the earliest and fast way at important points who are these people who are likely to be affected. Now coming to the individual level, and again this is where I would like to stress a bit more because a lot of questions keep coming on this. At an individual level, if we want to know how much is the viral load of the individual, okay, so viral load is basically how much of virus is there in that particular patient who is diagnosed COVID positive. So viral load, it can be taken as a synonym that how severe the disease the person may have, and similarly how infectious he may be. Okay, so to indicate this in the RT-PCR report, now it has been made mandated that you have to indicate something called a CT value, and people confuse this CT value with CT scan. So CT in RT-PCR is cycle threshold. Okay, it is not the computerized tomography what we use in radiology. So this is in microbiology itself, the cycle threshold of RT-PCR. If the cycle threshold value is less than 24, okay, it indicates the person is having high viral load. Again, You need not get panicked that I'm having CT of less than 20. There have been cases where the person is having CT of 10, 12, okay, but still he is asymptomatic. That may also be seen when the patient has undergone the testing, okay, and also it may depend on the lab where the testing was done, okay. So as the disease progresses, like a person who's diagnosed on day 2 may not have so many viruses because they are not replicating that fast, but if he is done on day 6, okay, the number of viruses which are there in his oropharyngeal and nasopharyngeal swab may be high, okay. So the time of the testing also matters for viral load. So no need to panic if just CT is less than 24. Then for indicating level of suspicion, I already told you we have CT scan. Okay, so this CT scan is different from the earlier CT again. This is a radiological test. And for this, we have a value. Okay, there is something called a CORADS, COVID Radiological Likelihood Scale. Okay, so if the CORADS is more than 4 on CT scan, okay, and if RT-PCR is negative also, it is a high level suspicion that the lung involvement, I told you, CT doesn't say the person to be having COVID if there is no lung involvement. Here, if it is lung involvement, because lung involvement is the thing which is of concern for us, because people die because of COVID when the lungs are involved. Okay, so CORADS of 4 and above on a CT report suggests a high level of suspicion that the patient may have COVID-19. Okay, and if RT-PCR is also confirmed and CT is there, that becomes CORAD 6 automatically. So indicating prognosis, we have something called a CT scan score. See, this is why a lot of people are getting confused. The community is confused. Okay, and that's why you need to be aware about these simple terms, because people use this often and they don't know where and how to use this. So CT scan score is different from CORADS, because in CORADS, it just says based on the pattern of the picture, the CT picture, whether it is likely because of COVID virus or not. But the CT scan score says how much of the lung is involved. Okay, the upper lobe, middle lobe, lower lobe, both the lobes. Okay, and when the CT scan score is more than 15, okay, that is almost 60 to 70% of the lung involvement is there. It becomes very difficult for the person to breathe on his own. He will require some support. Okay, either it may be an oxygen or a non-invasive ventilation or a ventilator itself as it progresses. Okay, so CT scan score more than 15 suggests a severe COVID because it has already gone inside the lungs. So these are the different CT, different measures what we are seeing, and you should know the difference between these because you need to create awareness. You should be aware before you can create these awareness. Okay, don't panic with any of the values. Next, for managing the patient, as I've already told you, we need few inflammatory markers, which I've already told you, because starting a patient on anticoagulants like heparin, or it may be starting on steroids, okay, or things like tocilizumab, remdesivir, although both these are questionable, it keeps changing every day. What was there last week, now the treatment guidelines are not there, the management guidelines are not there, okay? But a clinician or a doctor who's there in the ICU, hospital, or who's in contact with you will be updated on this, okay? So don't judge for yourself, look at the reports and panic, okay? So it's not the job of the patient nor the job of general population to get scared looking at the inflammatory markers. Okay, there are better people. So here we have to create their awareness that when inflammatory markers are high or reports are not suggestive and it's not going well with the clinical. Clinically, the patient may be better and inflammatory markers are coming very high. Okay, so no point in getting panicking. Should I take a hospital bed or things like that? Please consult a doctor. So you are advised also when you are there with the community, when you are reaching out to the community, you need to tell them that when these things happen, please consult the doctor. So you can't address every concern which the patient may have sometimes. Okay, so you need to know where to stop and till where you can give help to these patients. Last, vaccine response, I have already told you, antibody titers, the specific anti-spike, if it is more than 15, but again, it is not very, very confirmatory. There have been people who have got the disease even with this, so don't let off the guard. So COVID appropriate behavior is very, very important. So serology or antibody response, it shouldn't be used as a good marker for the antibody response. Next. Right, I have already covered this, so I'll not dig in detail. So this is the same thing what I was telling you, the contact tracing, that is from the patient, whoever he has come in contact with, starting from the 48 hours before the onset of symptom, or in an asymptomatic 48 hours from the time the testing was done. Okay, so we have to identify their names, contact, where they were, date of first exposure, last exposure, whether the patient was symptomatic, how close the patient was, whether he was wearing mask, whether the contact was wearing mask. All these histories will be collected by the patient. Okay. So important here is, as I told you, people may get annoyed. Why I'm being called so many times? I've filled my details on Arogya Setu. I got call already from the war room. I got already the call from DC office, but again the PHC is calling. Okay, but they have to do this. This is the time where you may have to be a bit patient and cooperate with the health authorities. Okay, so if you're lucky enough, you may just get one or twice, and good synchrony may be there. Okay, but providing good and clear information is very, very important and should be told for every patient. Okay, I was telling you there have been instances where patients have hidden information, or the primary contact has told the patient not to give the information, and later the patient died because of COVID-19. Okay, we can't test a patient if there is no immediate details given about the primary contacts. Okay, probably if they give their contact details clearly, we can trace them, we can test them early, and right treatment and management will be available for these patients. So that's why contact tracing and testing is very, very important. Next. Yeah, now a lot of patients, I told you, almost 80% of the patients are asymptomatic. In the first phase, as per the Karnataka COVID-19 dashboard, in Dakshina Kannada, almost 60% of the patients were asymptomatic or mild. Okay, so these cases can be asked to monitor themselves at home. Okay, and frequently they'll have to monitor their temperature and their oxygen saturation. So as you can see in the picture on the right top hand side, okay, it's a small device which will be connected to the finger of the patient. Okay, he just has to keep his finger inside the machine. Okay, and this detects in the blood how much of oxygen is there. That is what is oxygen saturation. So if the lungs are working clearly, if the lungs are not involved because of the disease, okay, so the lungs will be able to give oxygen to most of the organs. And imagine the finger is the most distal part. Okay, so that you will be seeing how much is the concentration. So this saturation of oxygen, which should be there in the blood, should be more than 94%. So this is a simple test which goes by the color. Okay, that's why the color of the blood will say how much oxygen is there. So if it is more than 94%, the saturation is more than 94%, that is at resting. Okay, 5 minutes, he is not moving and is not talking or anything. Okay, and if it is more than 94%, it is indicating that he is fine, he is having a mild disease. In some cases, we can also do something called a 6-minute exercise test or a stress test. Okay, this is done for people who are actually having comorbidities or risk factors, okay, elderly and all. So we ask them to do a brisk walking. Brisk walking is walk briskly till they say they are able to feel that gripping like sensation in their legs. Okay, the popliteal muscle, they feel that the sensation. Okay, after the 6 minutes, you again see the saturation. This is the 6-minute exercise test. If there is a 3 or 4 points dip from the resting rate, again that's a concern. If it has come below 94. So these are the 2 tests available which can be monitored, and at the same time you also need to tell them that what treatment they need to take. It is mainly supportive. It's a viral illness, so you may need to give paracetamol for fever or any antipyretics. Mainly paracetamol is the safest. 650 mg can be taken. Antitussives, that is cough syrup. Okay, CPM or cetirizine for cold or coryza. Okay, so these are the simple things. Apart from this, people keep taking vitamin C, zinc. There is nothing harm, although there is no definitive role. And also now 2 other drugs, ivermectin and budesonide, are also being recommended. Okay, but again, it will be started by the doctor depending on what is the patient's need, the risk factors, and also the likelihood of progress. Okay, so patient along with this has to be told that he needs to be in constant touch with his treating physician. Okay, tell him about the symptoms, keep a chart of SpO2 as well as temperature on a daily basis, because for he needs to be isolated for at least 17 days from the onset of symptoms. Okay, and anytime if he is having any worsening of symptoms, he may need hospital care. Next. Yeah, so management, I told you, based on severity, it may be asymptomatic, it may be mild, so where saturation is more than 94%. Okay, so moderate COVID are those cases where the pulse oximeter is showing saturation somewhere between 90 to 94%. And severe COVID is where when the pulse oximeter saturation shows less than 90%. So saturation becomes very, very important. Uh, and the treatment also depends on this. Okay, so moderate patient may need hospitalization, and in severe COVID or critically ill COVID, okay, where the patient is already having COVID pneumonia or ARDS, where he needs a ventilator, not just oxygenation. So I've told you symptomatic treatment, moderate cases, severe, critical. Role of drugs, I think a lot of people keep asking about remdesivir. That's why it is going in black market. Okay, so it's a drug which is available for 899 rupees. It's going for 60,000. There's one more drug called tocilizumab, which is going for almost 4 lakh. It's a single dose thing, but both have been not recommended. But unfortunately, it's going rampantly in black market. Although the evidence doesn't show any benefit of these two drugs. Okay, that much is the panic, that much is the fear which COVID has caused. Okay, and it's our responsibility to tell people if you are having mild case, no need of taking these drugs, no need of hoarding these drugs. There may be a person who actually needs these medicines, and because you are hoarding, that person may not get it in the hospital if at all the doctor decides he needs. Okay, and if at all required, he may not get, and he may succumb to the disease. Okay, similarly, oxygen cylinders. Okay, you have seen the case in North India. Thankfully, we have not reached that stage here. Okay, similarly, steroids. It's again a widely, rampantly used drug. Everyone starts using it. Okay, it's not needed. If you're not hospitalized, okay, you need not take steroids. It doesn't do anything good. It does more harm. If you are having any other infections, it can worsen. Steroids suppresses your immunity. Okay, so it may be bad. So you shouldn't be taking steroids unless medically indicated for COVID. Next. Yeah, so vitamin C and zinc, okay, no beneficial role as per WHO, but we keep giving it, okay, a lot of patients keep taking it, but there is no harm, okay, vitamin C 500 mg, BD or TID. Similarly, zinc, okay, it's available as 10 mg tablets. We give up to 4 to 5 tablets in a day for 7 days. So for all mild and asymptomatic cases of confirmed COVID. Next. Yeah, what happened with the second wave? I think when the second wave happened, a lot of my friends, as epidemiologists, we were discussing it's not looking like a wave, it's a tsunami. And the same thing now, most of the media people are also telling, because there was a sudden spike. Okay, when the number increases so drastically, okay, as I told you earlier, we don't have those many resources. Okay, so that's the thing which mainly had a toll on our health system, our doctors, and also all the systems were crumbled because of this sudden spike. So a lot of reasons for this sudden spike. Okay, there was COVID fatigue. A lot of people who are stuck at home, work from home, not able to travel, not able to go to movies. Okay, and always with masks, no parties, no get-togethers. I've seen. I'm not just blaming the general population. I've seen it with my doctor friends also. Saying unnecessarily you're worried, it's gone. And when the vaccine came, okay, I still remember I'm talking to a lot of doctor colleagues, and they're like, no, it's done and dusted. Okay, so that was the fatigue which was there with COVID. Unfortunately, it has shown that a virus so small, less than 5 microns, and still it is so strong to infect and create panic in our community. So we are seeing increased transmissibility now with the second wave, as I told you, because of the mutant strains. And as so many cases are seen suddenly, we have a resource crunch. Probably if we had more beds, more doctors, oxygen, drugs, okay, probably it wouldn't be a pandemic. Okay, but that's why it is called a pandemic, because we have a resource crunch. Our number of cases are exceeding the number of facilities and the health system capability, what we can do in a day or in a time of 14 days. We can't remove a patient of ICU and give priority to another patient. So we need to decide. That's why it becomes very important for every individual to take a stand here, that whether I should go for an hospital care. Do I need hospital admission? So it is left to the individual also, not to hold on to beds, not hold on to drugs. Seek proper care at the same time. Okay, don't think that I have COVID, I'm having breathlessness, but it's okay, I can take home isolation. No. Okay, that doesn't mean so. Okay, so if you have breathing difficulty, saturation is falling below 94 or 90, you can't take treatment at home. Okay, so you need to take a right call, obviously, and ensure everyone gets the right treatment. That time, the resources available will be available for every person. That will be doing good deal for the maximum people. Next. Yeah, so what are the prevention measures available? I think we have discussed this, so I'll not be telling everywhere it keeps coming, radio, TV, everyone says, so I don't think we need to say physical distancing, at least do gaj ki duri, that's what is commonly said. Use of mask. Now, I think a lot of people may have questions about this. So specifically, I want to request most of you is please don't hold on to N95 masks. Okay, N95 masks are mainly required for healthcare settings. So, as the pandemic progresses, if at all there is a worsening of situation, it's mainly needed for healthcare professionals because they are fighting the pandemic. Okay, so a simple cloth mask, which is double layered, will be able to filter off almost 50 to 60% of the viruses. And with that, if you are ensuring physical distancing and hand washing and other respiratory etiquettes, okay, so you will be able to protect yourself. Okay. Similarly, when you're using 3-layer surgical mask, make it as a knot. The idea is you have to have a tight seal so that it's not, the virus is not able to, can just go back one slide. Next slide, yes. So hand hygiene, again, very important. So people keep using sanitizer, but sanitizer is effective when your hands are not soiled. Okay, so please remember, if you have coughed or sneezed, okay, so that is contaminated particles. Sanitizer, which is alcohol, okay, will not be effective in neutralizing the virus or any other infection material. So in such conditions, you have to wash your hand with soap and water only. Okay, sanitizer will not be effective. So sanitizer is when my hands are not soiled. Okay, I can use sanitizer. Again, the 6 steps are very, very important so that every part of your hand, okay, which can be coming, will be tending, generally missing out the intertriginous as well as the one near the wrist. Okay, so these parts also need to be cleaned. Okay, in hand hygiene. Need to have good ventilation, good cross ventilation when you are there indoors. This is very, very important. And respiratory etiquette, again, a lot of people have been asking about this, coughing onto your sleeves. Okay, so that and not using, not shaking hands, elbow bump, okay, or some innovative things so that you are not coming in contact with the most likely contaminated surface, which is the source of transmitting this respiratory droplets. Now, coming to the vaccines, I'm sure a lot of people will have queries on this. So currently we have 2 vaccines. Another 3 vaccines are in the pipeline, okay, including Sputnik and Johnson, and also Pfizer may be coming into the market. But currently the vaccines we have, Covishield as well as Covaxin, both are equally effective and safe. Okay, Covishield needs to be taken as 2 doses, at least 6 to 8 weeks apart. So in Dakshina Kannada, we are following 45 days. It's easier for the person to know. And Covaxin, it is 28 days. Okay. So the questions which keep coming are now, because there have been a lot of things going on in the media saying during menstruation, girls are not supposed to take. And from May 1st, it's open for all youth above the age of 18 years, because till now it was only above 45 years. Now from May 1st, all above 18 years can take it. So everyone can take it. So vaccine is not contraindicated in menstruating girls. Okay, and people with comorbidities, it's a need. And youth are the most important people who will be getting the infection because they're going out. Okay, promptly bringing the infection back and spreading it to the elderly people who are there in the house. Okay, so moment you are eligible, please take any of the vaccines which are there. It's safe. And if at all there is a COVID positive person, this also keeps coming as a query. If you have recovered from COVID, you need to defer the vaccine for at least 6 to 8 weeks. Okay, so from the time of recovering, 6 to 8 weeks gap is essential for taking these vaccines. Now, vaccine hesitancy is mainly because of the fear how quickly it came. Normally, vaccines take 20 years, 30 years to come. But imagine that's the reason why we are seeing, and there is good data. 2 days back, Government of India released a data on Twitter handle, on its Twitter handle, saying the risk of COVID infection, what was seen in vaccinated individuals, it was only 0.03%. Okay, and no one developed severe COVID. Okay, that's a data which government is telling. So, although it is not preventing the disease, okay, it's definitely the effectiveness is not 100%. It's somewhere around 60 to 70%, but still it is good because it's ensuring people are not succumbing to the disease. Okay, last year we saw almost 3,000 to 4,000 healthcare workers dying because of COVID. Okay, but vaccine may prevent this particular number this high. It was more than soldiers, the number of healthcare personnel who had died last year because of this pandemic. Next. Yeah, another important thing is the fake news, the infodemic which is there in the media, social media. This may cause panic, it may create mayhem. Okay, so you have to take a responsible call. So search, there are a lot of platforms. I will, next few slides, I have just kept it for reliable sources of information which you can go to see or seek appropriate advice, or you can actually cross-verify whether they are genuine or not. It may be related to COVID transmission, it may be related to the test, it may be related to the hospital, it may be related to the vaccine, okay, or even treatment sometimes. Okay, so please verify, okay, because a lot of patients go by social media messages, WhatsApp University these days. So you have to be very careful so that you realize what is a true news, what should be taken, and what shouldn't be forwarded. Okay, so forwarding these fake news, you will be becoming accountable. So much so, similar way like the person who has forwarded to you. Okay, so please go into these sites like I've given now, covid19.karnataka.gov.in. So this is one site. I'll next slide. I'll just quickly run through these sources. Yeah, so this COVID attitude, this also was responsible. Especially we had seen this in the youth. Okay, not wearing masks. Let's get the infection. Okay, so that this was there in US, very rampant in the first wave, and we saw this in India itself. Let's have the infection done and dusted. No need to wear mask. No need to take vaccine. No need to be worried about COVID. Okay, but please, again, as you also need to remember, you may be bringing this infection. You may be recovering without any sequelae, but there may not be people who are fortunate like you, who don't have good immunity. They have diabetes, they have hypertension, they are having immunocompromised conditions like on anti-cancer medications. Similarly, the concern with the vaccines, a lot of people had raised. Okay, so it takes around 7 to 34 years and so on. But imagine that's how our scientists are. The need was so much that's why we had to come within a span of 10 months. The vaccine was needed, and even people criticize WHO, but WHO also has done good things. Okay, imagine this is a pandemic. So everyone will be taken to task. No one would have seen in their lifetime. I told you 1918 was the last time. I don't know how many people were even alive in major organizations to handle this particular pandemic. So WHO has something called a COVID-19 accelerator tool, ACT, where they have given on emergency authorization approval for these vaccines, drugs, diagnostics, so that moment a vaccine is showing effectiveness, it is safe. So no one is compromising on safety. Okay, efficacy may be compromised, but safety of people is a priority. So no vaccines come without a safety clause. Okay, so that's why we are seeing vaccines which are 60% efficacious also. There are vaccines like the Pfizer, Moderna, which are 95% efficacious also. Okay, so it's left to you, but again, it's always better to take a vaccine rather than not taking a vaccine. So we may not have the privilege of taking high efficacy vaccines now, but these vaccines also prevent against severe COVID. So that's why we have to take the vaccine. So don't go by the false messages regarding this. Next. Right, so COVID-19 information portal, this is the dashboard of Karnataka state. So if you have any queries, like where should I get tested? These are the fever clinics. So all the fever clinics details will be available. Where I can quarantine myself if I have come in contact, where I can isolate. These are the hospitals. And designated hospitals, I told you, the Ayushman Bharat Arogya Karnataka scheme, now along with Venlock, all the medical colleges, private medical colleges are designated hospitals. Next slide, please. Yeah, so to look for specific media bulletins, the Karnataka government as well as Dakshina Kannada district releases every evening a bulletin saying how many tests have been done, how many people have been vaccinated, how many people are discharged. Okay, but the media looks into only the number of cases and number of deaths. Okay, so please look into the media bulletin, which also says how many people have been discharged. So media bulletin from these sites will be giving a good picture, a clear picture that this disease is still manageable, provided you take all precautions and you are aware about what needs to be done, what not needs to be done with good prevention measures. Similarly, all government instructions, it may be regarding anything which is being passed by the ministry, Okay, awareness messages. If you think you need to have good pamphlets, posters, rather than making your own, this will be available free of cost also, and you can create good awareness. Next. Again, COVID-19 dashboard of Karnataka. Next. Yeah, these were the media bulletins, what I was talking about. Yesterday's bulletin of the state, what you are seeing in the left-hand side. Okay, see total active cases, new cases. Look at the discharge. Okay, the second thing. So people should start showing as compared to the number of positive cases or number of new deaths. Look at the new discharges. Okay, 201 deaths, 10,663 discharges in one day. Okay, so no one shows that in the media, but you need to know about this also. Okay, otherwise you'll keep thinking in your mind, and there is a lot of mental issues also which can be seen in people who are not having COVID. Okay, you're there at home, you're just watching the news channel, you're just getting scared whether I just sneezed and can this be COVID. Okay, so these all sorts of informations are very, very important. Okay, next. Yeah, this is the COVID-19 helpline 1077. If you need any assistance, immediate help for COVID. That's a WhatsApp number. That's a website, dk.nic.in. COVID-19. Next. Yeah, these are the containment zone information to know how many zones in your area are currently contained. You're not supposed to travel in these areas. There will be a high risk of transmission. So this will be available. Next. Yeah. Details on any advisories. Okay, regarding it may be travel. Do you need a pass for interstate, inter-travel? For if you plan your travel outside Karnataka, outside India, if at all it keeps changing. This is the website you should be looking in for information rather than WhatsApp forwards. Yeah, important helpline numbers. Next, these are all the helpline numbers. What I've put after Mitra, 108. Okay, 104 for other essential health services. So all these numbers are important to be remembered during these tough times, because it's not just COVID-19. There are other diseases also which are prevalent. So yeah. So now this is the good thing which is done by state government. Okay, there's empaneling private hospitals as COVID hospitals. Okay, they have fixed the norm. And every hospital, they have given a Aptamitra under Ayushman Bharat Arogya Karnataka. Okay, so these people who are there in the like our hospital, there are 2 people. So any queries, the numbers are being displayed, so people can call them asking about any information. It may be regarding oxygenated beds, how many are available, how many are filled, how many ICU beds are available. Okay, whether I can come for testing now. Okay, all these details can be easily accessed. Okay. So if they have the Ayushman Bharat card, this treatment will be gone with me. Yeah. Now these important things. Okay, people, mental health of children and elderly. Okay, because that's the time. This is the time when if you don't address to their healthcare needs, and if they keep seeing the messages like what I told you, the fake infodemics on WhatsApp or news channels, media, social media. Okay, so keep talking to them, keep them involved. Okay, otherwise they may just go in for a depression or an anxiety, panic attacks, and children also, because they are not being allowed to play outside, and all the time on Zoom calls, Zoom classes. And lastly, very important of the healthcare workers. Okay, I'm not exaggerating. Off late, last couple of weeks, a few of my friends on our WhatsApp group. It may not be in Karnataka. Most of my friends in North India, they just gave up. Like, we can't do anything. You must have seen on WhatsApp also. That's like even now when I'm saying this, it's actually giving shock in my spine. Actually, imagine when I always feel when the doctor says the situation is out of control. I don't know what will happen next. Okay, that is really bad. Okay, we don't want that situation to come to Dakshina Kannada. We don't want that in Karnataka. Okay, so as of now, luckily, touch wood, although our ICU beds are full, but we still have oxygens available. We are able to manage it. It's more necessary that we encourage people to follow COVID appropriate behavior. The regulations probably will be helpful so that the infection rates drop down. But there is no other way. We need to ask people to follow COVID appropriate behavior, take the vaccine, stay indoors. And now, apart from staying indoors, please wear mask also indoors. That also has become very important in the second wave. Next. Yeah, so these are the messages probably which should be going rather than saying deaths and all. Okay, so I think I keep circulating this when people ask how many deaths today, how many cases today. So these are the examples who have defeated the COVID. Okay, 101-year-old, 103-year-old. We have infrastructures. It needs ramp up. It needs time. Okay, but yeah, we will definitely fight through this. Next. Yeah, so some important source of information like the Government of Karnataka Corona Health Desk. You can dial this. You can test like high on, or you will keep getting facts. Okay, you will get like a drop down what information you want about the vaccine, about testing, about management, everything. Next. Yeah, some good things what we have done. I just thought I'll just add on to this. Like there is tele ICU which Government of Karnataka has implemented for most of the facilities, because every hospital may need not have an intensivist, but an intensivist who is sitting in one place will be able to tell n number of doctors who are not emergency physicians how to manage a case. So that was a really good initiative. There are a lot of digital innovations. Truly, we were an IT hub, so that was rightly shown by our state as compared to other states. We have good public-private partnerships. Okay, we are rich. Karnataka state is rich with private facilities, and we have a huge pool of private doctors, private hospitals, private medical colleges, and government has tried to do its best. Yesterday's rule was to ensure at least 75% of the beds in these private hospitals should be reserved for COVID positive patients. We couldn't have these private facilities much in North India. So YouTube channel Jagruti Karnataka, you can get information on this. Next. Yeah, some health issues and concerns which people have is availability of health services. Can we reach out to any hospital? Which hospital we should reach out to? How to take care of vulnerables? Again, people, if you have an elderly with diabetes, hypertension, okay, please encourage them to follow COVID appropriate behavior. Restrict their movements. A young person in the house probably can go out to market or collecting goods. Prevent unnecessary movements outside, even children for that matter. Children are also getting, a lot of children are getting infected in the second wave as compared to the first wave. Decrease healthcare service utilization. I told you there is fear. They don't want to get tested. So this needs to be elevated. Okay, this is where I think your roles as volunteers, community volunteers, will be very, very important. So you need to tell people, please don't neglect these suspect symptoms of COVID. They have to come forward and get tested. And also, moment symptoms start, they have to follow more self-sustained measures so that they don't spread it inside or even outside. Health regulations, I think everyone knows what's the fine without a mask and with the lockdown also. Next. Yeah, e-Sanjeevani, it's an app. Yeah, so yeah, next please. I'll just take a bit time on this. So a lot of people had queries how to register, because from tomorrow registration will be open for people above 18 years, and the vaccination process will start from May 1st. So this is the site, that is selfregistration.cowin.gov.in. So you have to enter your mobile number on this portal. You'll get an OTP. Okay, so this OTP, every time once your mobile number is linked, you'll be able to book a slot. Okay, slot will be which facility you want to choose. Okay, government, private, and date. Okay, so date, forenoon, afternoon. So this will be there. And what happened with the registration of 65 and 45-year-old plus patients? With each mobile, each mobile number, they were able to register 4 people. Okay, so hopefully the same thing will be continued with this portal. Next. Personal experience, I think I'll not touch on this. I think we have already reached a lot of time. I'll give more time for question and answers. Yeah, okay. So these are some of the issues which doctors are facing. So please trust your doctor. Not always doctors are faking the cases. There you might have heard COVID doesn't exist. It's just the doctors. Trust me, we don't want to be in a pandemic scenario. We also want to enjoy. I've not seen I've not met my parents because I'm also scared. I don't want to give the infection to them. So yeah. Okay, next. Yes, these are some of the important publications that come from the government of India as well as WHO. How to maintain essential health services is important, and stigma, which is there for a COVID positive patient, which was there more in the first epidemic. Okay, so because if there was one case in the neighborhood, everyone will be contained for 28 days. Okay, so people didn't want to test that time, so there will be a board put on the house and all. So how to overcome this? That's the module on this. It's a good book if you want to read, especially for community volunteers. Next. Yeah, so take home messages as volunteers, beware of fake messages. So you should be the ambassadors, not to carry wrong messages and give these wrong messages. You should get the right source of information, code the information if needed, save the information, follow COVID appropriate behavior yourselves. Okay, that is social distancing, mask, use of sanitizers, and encourage people to use. Take vaccine moment you are eligible. Keep faith in the healthcare system. It's a humble request. Act responsible. Okay, don't give wrong messages or don't criticize people. Don't insult doctors, healthcare professionals, frontline workers. Help people in need. Now again, this is a concern. Again, there is lockdown. There will be migrants. There is a lot of people who are in dire need of your. It need not be COVID all the time. Okay, so people may need other help also. So please be there. This is a time when we need to show that we are actually humans and the superior species on Earth. Next. Yeah, so I would like to end with these two wonderful quotes. Thank you. Thank you for patient hearing. I think I have exceeded my time allotted to me. So if there are any questions, I'm ready to take.
Thank you, Dr. Sudhir. Dear participants, as we know, Doctor has taken the vast sphere of the subject matter of COVID-19 as well as the awareness, and especially has concentrated on us, the youth of India, or youth especially of Dakshina Kannada, how we need to concentrate and build up a community awareness and fight against this pandemic. There are numerous questions which have come in the chat. I think through the chat box we can see the questions, and I request the doctors to answer those questions which have come in the chat box.
Yes. So, I think Ashok M. Prasad has asked whether people who are testing negative after mild symptoms are more dangerous. So, nothing like they are more dangerous. The problem, what happens is when a person is negative, we are not doing contact tracing. We are not giving him isolation guidelines. So, what should be done is any patient who is symptomatic during the current ongoing outbreak should be considered as a likely COVID suspect. So, he should follow all COVID appropriate behavior and try to isolate himself. Okay, he should stop interacting with people, probably should stay at home for 14 days. And again, as I told you, CT scan and D-dimer, if you get it done early, and it's highly likely that it will come negative. So CT scan will be able to pick up the lung involvement, because the time taken is roughly around 5 to 7 days. If it has to progress, it doesn't involve directly the upper respiratory tract and go to the lower respiratory tract. Okay, so CT scan has come likely positive at least from 5 to 7 days. As I told again in my presentation, CT scan will just show if there is lung involvement. If there is no lung involvement, if it's still restricted to the upper respiratory tract, the patient may not be detected by a CT scan. So CT scan is not the diagnostic test for COVID-19. So D-dimer, again, it doesn't say COVID, it's a supportive test. It will say if there is blood clotting abnormalities. Okay, because if you want to start on anticoagulants, this is the test needed, which can happen in COVID. So both CT scan and D-dimer will not be saying COVID or not. That's the first thing. Second question is, if we take vaccine, will we be safe from corona? Yes. So as I told again, vaccines will not 100% effective against COVID. Okay, but the transmissibility has been reduced as seen by the government data, as I told you, which was there, and it is definitely preventing people from having severe COVID. So it is our responsibility that we take the vaccines, encourage people to take the vaccines moment we are eligible, and also encourage elderly people and those who are likely to be having severe COVID, the risk group, that is people above 60 years, those having diabetes, chronic diseases like ischemic heart disease or asthma, underlying immunocompromised conditions or lung involvement. So they should be taking it. You may be safe, but you may be giver to others. I can be correct. So I feel even after taking vaccine, we must continue to wear masks. Yes, very rightly said by Naveen. So COVID appropriate behavior has to be followed even after taking vaccines. You shouldn't let your guard down. Do we have a proper medical treatment for COVID-19? Yes, medical treatment keeps evolving. As of now, please remember there is no definite cure as such. Okay, we give symptomatic treatment, and if at all the symptoms worsen, we manage those symptoms which needs to be life-saving procedures for the patient. Okay, so medical guidelines are there. It has been again revised on 23rd. Okay, you can see it on the COVID information portal what I have told. It is separate for mild cases, moderate cases, severe cases. So it has to be kept the same. Okay, treatment guidelines cannot be interchanged. You can't take you can't take steroid which is recommended for a severe case because it's recommended as a medical treatment for COVID-19. So whatever is the treatment guideline for a definitive COVID-19 disease, okay, mild cases should be the mild treatment itself, which is fluids, symptomatic treatment, paracetamol for fever, and other medications. Next question is it safe to take vaccine? Because I have witnessed some people after vaccination, they are down with fever for 3 to 4 days. In social media also, many are spreading the news that this vaccine is just 50% effective and no guarantee of life saving. Is this true? Okay, first thing, vaccines are safe. And Mr. McQueen, what you have said, people being down with fever, any vaccine when you take, you must have seen this with DPT also. When children take this, we also give a Febrix Plus or a paracetamol tablet to these children, because most of the vaccines, when they are given, when they are inoculated, there will be an antigen antibody reaction. That itself says the body started producing some antibodies to a new foreign antigen which has been given to you. Okay, so some amount of fever is actually good, but people, if they are having severe fever, again you can take Dolo 650, that is paracetamol 650, so that the symptoms doesn't trouble you much. But I would still say vaccine is better than having severe COVID and then searching for hospitals. And about the efficacy of the vaccines, again, as I told you earlier, efficacy may be different for different sort of vaccines. Currently, what we are having has an efficacy of somewhere around 70%. It's not 50%. There is an efficacy of almost 70% with both the vaccines. And with Covaxin, the recent data, it's said almost 78 to 80% efficacy. So that's actually good. Out of 180 people will not have the disease. 20 may still have, but all 100 will not have severe disease. So still, it is better. That's what I would like to say. If the first dose of vaccination was Covishield, whether the second dose to be taken the same, or we can take any? I'll answer that first. No, you have to take the same vaccine. You can't interchange between vaccines. So if you have taken Covishield, you have to take Covishield. If you have taken Covaxin, you have to take Covaxin. So there is no interchange possible with the vaccines. Because almost everywhere PHCs, doctors say that whatever supply they get the day, they give. Okay, no, they will not tell this actually. We have vaccine crunch now because a lot of people are eligible for vaccines. But you need to keep your own entry. At the same time, the portal also will show you which vaccine you have taken. So please ask when you have taken the vaccine, which vaccine you received, whether it is Covishield or Covaxin. With the newer vaccines in the pipeline which may come, it may be a bigger concern. So I would recommend or request everyone to spread in the message that not only the healthcare professionals who are giving you the vaccine, you also take note that which vaccine you have received, because these vaccines are not interchangeable. You have to use the same vaccine. So keep a note on yourself. So if at all you reach the PHC and there is no that vaccine, you don't take a wrong vaccine and come back and think you have taken both the doses. Okay, you have to take the same vaccine to get protection, because protection will be 14 days after the second dose. Is there any side effects of vaccines? Yes, there are side effects. No, none of the things which are given foreign, the body will take and initialize and inertalize it on its own. Okay, there will be side effects, but what we have seen till now are all minor cases. Okay, all are minor cases which can be managed. It is myalgia or fever. Myalgia is mainly body ache. Okay, there is fever. Some people had minor rashes. Okay, very rare. Very rare people had itchy spots on their body. These were all very rare, and with one dose of paracetamol or cetirizine or CPM, these symptoms subside. Sir, my roommate did have issues with her menstrual cycle for about 2 months after taking the vaccine. Do you think it's anything related to COVID? No, it cannot be related to COVID. There is no biological possibility that menstrual irregularities can be caused by the vaccine. So it's better she gets evaluated for, she seeks gynecologist help if it is annoying. Vaccines will not cause menstrual irregularities. Sir, in my place, vaccine availability is very less. So there are many individuals who took vaccine first dose, but now for second dose, it's not available. So what will be the procedures? Yeah, vaccines will be procured. As soon as it's available, people will be called. Okay, so if there is a gap of 6 to 8 weeks between the first and second dose for Covishield, it's still okay. So it's not necessary that you have to take exactly on day 42 or exactly on day 45. Okay, so there is a window period. So again, it's a humble request. As I told you earlier, the health system is taken for a toss. So manufacturers are producing vaccines, but to reach such a vast country like ours, it takes time. And we have now lowered the age limit also from 65 to 45. Now it has come to 18. So these things are more likely to happen unless the vaccine manufacturing capacity is rampant. I saw other day in the news, the Covaxin, Bharat Biotech was saying almost 10 crores they will be able to manufacture. So that should be addressing this issue. So what will be the procedure? I told you have to wait for the portal. Take your slot. So the website, what I was telling you, selfregistration.cowin.gov.in. Take your slot, take your date. Okay. Please visit the facility, and before visiting, also you can verify with that facility wherever you are taking the first dose whether vaccines are available or not. Okay. Only if it's available, you can go or take your elderly, because you don't want to unnecessary crowd. And more so with the lockdown guidelines there, you don't want to unnecessarily travel. So please verify and then go. Time gap between dose 1 and dose 2. Yeah, it is 6 to 8 weeks. 6 to 8 weeks. That is anywhere between 42 to 56 days. So I told you in our facility, we are practicing 45 days, day 45 from the first dose, considering dose 1 as day 0. We are following that right now. Okay, so 6 to 8 weeks is the safe recommendation what Government of India has made. Alan Christie, sir, how effective are the COVID vaccines against the new COVID-19 virus? Okay, there are mutants, as rightly pointed out. We don't have data, Alan, as of now, whether it will be protecting or not. But what we are seeing is, as the government has released the data 48 hours back, as I told you, it is having some amount of cross immunity for sure, and it is definitely protecting against severe disease. First of all, let our elderly be vaccinated. Yes, elderly more than 65 had their vaccine slots available. Many people have been taking it. Few are refusing because of vaccine hesitancy. Sir, did the new mutant transmit through air? Yes, all COVID-19 viruses are transmitted through air itself. So whether it's a new mutant or old, everything is through the air. Some hospitals are fakely giving reports as positive, but the same person, when they go for a second or third test, they are negative. Is this and how to know who is spreading fear? I would like to address this. As I told you earlier, this mainly depends on the timing when the test is done. Okay, so none of the hospitals want to give a false positive report because it automatically goes into the ICMR portal. And I told you all ICMR labs, they are accredited labs. So if at all ICMR detects these hospitals are doing, or these laboratories are giving a false report just for the rumor mongering or making more money, okay, they are more penal actions and procedures will be more against these hospitals. So none of the hospitals want to take the risk. Okay, so there is least likelihood that the hospitals are giving false positive. as the earlier question was there, false negative. I've heard people, I've seen few cases also, reports coming negative, but actually having COVID. But false positive, this is again, I told you this was more rampant in the first time. People going lab to lab, still they get a negative report because they are in denial. They say we have worn the mask, we are responsible people, we can't get COVID. Okay, so this is just denial. No false, no reports will be made false by any of the labs or hospitals is what I feel. Definitely people don't want to take that risk. Dr. Aruna Kalkur, according to you, how many days gap is good for the second dose? Yes, 6 to 8 weeks is good. 45 days is a good gap, so that the 42 days is normally the time we say so that our immune responses are building up. So anywhere between 6 to 8 weeks is good for Covishield and 28 days for Covaxin. So this cannot be changed. Covaxin has to be 28 days and anywhere between 6 to 8 weeks is a good gap for Covishield. Some are saying those who are having allergy should not take the vaccine. Okay, this is a very good question because this I keep getting almost like 50 to 60 messages every day. Okay, so when we started and a lot of people were asking this egg allergy, allergy to penicillin, allergy to antibiotics. There was no data available earlier. Okay, even now we don't have evidence reports, but trust me, there are a lot of these healthcare professionals, doctors, our students, my own colleagues who had allergies but who still took the vaccine, and none of them had any reactions. Okay, so although there is no data on this, I would recommend you, it is still safe. You are having allergy, taking the vaccine, because if you have not taken the vaccine prior, if you have taken the first dose and if you had very bad allergic reactions, then don't take the vaccine. But if you are having allergy to some other drugs or some other food items and you don't want to take, it's not a good decision is what I feel, because many people have taken safely without having any other side effects. Is there any age limit for getting vaccinated? Yes, the current available vaccines, Covishield, Covaxin, have been tested only above 18 years of age. Okay, so it has not been also that we don't have enough data on pregnant and lactating women. So any people above 18 who are not pregnant and not lactating are eligible to take the current available 2 vaccines. Is Ayurvedic medicines effective for COVID-19? I am not a Ayush practitioner, so I'll not be able to comment on this. Government has recommended a few kadas and medicines, but again, if at all you are taking, take it from a reliable source, an Ayurvedic doctor or someone may be able to tell you whether it's good or not. My concern is not, I'm not against Ayush or anything like that, but Dr. S.K. Sareen, who is the one of the famous hepatologists of India, he actually, and he is the director of Institute of Liver and Biliary Sciences, one of the premier institutes for liver. He has said that soon after COVID started, people have started taking a lot of these Ayurvedic medicines and are coming with liver anomalies. So please take in the limit whatever is prescribed. Don't think that these won't cause any side effects. They can also harm if taken in excess. So please be aware about that. So take only with prescriptions and as advised by an Ayurvedic physician. How long will it take to build immunity after getting the COVID-19 vaccine? Okay, it takes at least 14 days, that is 2 weeks from the second dose, okay, to get the immunity. What are the problems we'll have to face if we take first dose Covishield and second dose Covaxin? You will not be getting these vaccines, and it's not advised to interchange the 2 vaccines. It's not recommended by both of the manufacturers, not the Ministry of Health and Family Welfare. So your chance of getting first Covishield and second dose Covaxin will be very, very rare because the healthcare facility is taking note of it. And that's why I told you, please, you also take a responsible decision that you keep a note which date you took the vaccine and which type of vaccine you took, so that this problem can be advised. Okay, so this shouldn't be happening. Sir, elderly and children are more prone to COVID. Still, age limit have been lowered only to 18. Is it because the side effects are not yet completely determined, that it's not made available to children? Okay, what we are seeing as compared to the first wave, it's a valid question. As compared to the first wave, where children were not getting involved so much, in the second wave, we are seeing a lot of cases of COVID-19. You are right, but again, we are not seeing severe COVID in children. Okay, a few places in Maharashtra have reported this. But why we are not vaccinating children is because we don't have vaccines for children. For a pediatric trial, pediatrics are not small adults. Okay, they are a unique population in themselves. And if we have to develop vaccines in children, we have to do separate clinical trials exclusively in children, because the ethical procedures, they'll not be able to give consent. They'll not be able to take decisions whether it's good to take vaccine or not, unlike adults. Okay, so the parents have to take a call. So there may be some ethical issues, and also that's why the vaccine trials which have to be done in children are coming up. Okay, so these vaccine trials, once they finish, then only we'll be able to vaccinate children below the age of 18. So till that time, children will not be an important group as far as COVID vaccines are concerned. After how many days we can donate blood after taking second dose of vaccination? Yes. So at least 28 days, 4 weeks is the current recommendation what is being given recently. Okay. So 1 month should be the time so that you abstain from donating blood. So another thing what can be done is a lot of health messages you might have seen, IECs, that please donate your blood and then go to take the first dose of the vaccine. Because if a lot of youth are taking COVID vaccine and they are not eligible for 28 days, okay, that will have a huge pressure on our blood banks. So what are the restrictions after taking vaccine? There are absolutely no restrictions. I think there was a rumor about not consuming alcohol and all. So nothing like that. Alcohol can be taken. If a person has tested positive, then does he have to wait to receive the vaccine after testing negative? If the person has tested positive, yes. As I told you again, he has to wait for at least 6 to 8 weeks. A COVID positive person has to wait for 6 to 8 weeks for taking the vaccine. And no repeat testing is advised. Okay, any person who is tested positive for COVID after 17 days, we release him from treatment. He will no longer be considered a COVID case. So attendance is not in my hands.
The amount of questions that have come itself is a proof that how effective was the talk of Dr. Sudhir Prabhu on the topic community engagement and responsibilities of preventing COVID-19 in Dakshina Kannada. I know there are still questions due to the shortage of time. We'll move further. I request Lieutenant Hariprasad Shetty of NCC Naval Wing to propose the vote of thanks.
Gratitude is supposed to be the language of heart. Good evening to all. I would like to take this opportunity to thank our resource person, Dr. Sudhir Prabhu H, for enhancing our knowledge on community engagement and responsibilities for preventing COVID-19. Thank you, Doctor. My sincere thanks to our principal, Reverend Dr. Praveen Martis SJ, for his kind support. Thanks to all the participants for your active participation. Special thanks to the organizers, Youth Red Cross Unit, all the 3 wings of NCC, NSS units of our college. At last, use soap water, wear mask, and keep distance. Thank you each and everyone.
Thank you, Hariprasad Shetty. Here we come to the end of this awareness. This is, as I said, it is not the end of the awareness program, it's only the end of the talk. The awareness program, you need to take it forward. So as we know, in Aloysius College, we have got a concept called Sahaya. You need to give your service to the society. So we, the co-curricular and the statutory associations of the college have decided in this method we'll be giving a service to the society. First one is, it is up to left to the students in any method you can give. First one is visiting to the visiting neighborhood. At least 5 houses you have to visit and give the awareness. As a proof, you need to take photos or the pics whenever you visit, and in one house you need to take the video as a proof of it. If your parents don't allow you, because most of you are first years and you are below the age of 18 years, therefore you need to listen to your parents in this regard. Therefore, if your parents do not allow you, then you can go for the second way, that is making a phone call to your friends or to the neighbors and giving awareness. At least 5 houses you need to call and give the awareness. If not phone call, then you go for Google Meet, live recording and giving the awareness. In that, minimum 10 participants should be there to give the awareness. And it is suggested that you prepare a PPT and do the presentation for the as a method of giving service to the society. So thank you one and all. Have a nice day.